Hello everyone, welcome to Late Night with Katie Emer. On tonight's show we're going to be discussing a type of staph infection called methicillin-resistant Staphylococcus aureus, or MRSA. First up, we're going to have Dr. Jen Stanley come in to explain the infection. Welcome, Jen.
Hi, Katie. It's nice to be here. A staph infection is a minor skin condition that's not normally contagious. It's most common infection in the U.S. and it's carried on your nose, skin, and feet. You can carry it without any symptoms.
Wow, that is remarkable. What else can you tell us about staph infections?
Well, some forms of this infection can be resistant to antibiotics, but for the most part, they can be cured by antibiotics or naturally by the body.
Interesting. What else can you tell us more specifically about MRSA?
MRSA is a staph infection that is immune to penicillin or other antibiotics in the penicillin family. It can be treated by the use of other antibiotics, though.
Well, what causes that resistance?
Great question, Katie. When people take the antibiotic incorrectly or decide that they feel better and stop taking the prescription earlier than prescribed, then the infection becomes immune to it. Or sometimes people take the antibiotic for a virus infection instead of a bacterial infection.
Very interesting, Dr. Stanley. What can come of MRSA? How severe can it get?
Well, normally a person can go to their doctor's office and get antibiotics prescribed to them to treat the infection. But sometimes MRSA can cause pneumonia, serious infections in the blood, heart, and open wounds, and can even lead to death if it's not treated appropriately.
Wow, I didn't know it could be so serious. How can a person contract this disease?
Most likely it will be contracted by a direct skin-to-skin contact with someone who has the disease, but it can also be contracted indirectly. For example, if a person who is infected uses a cell phone and drainage from the wound gets on the phone, a healthy person can get the disease. It is also likely for a person to be infected if they have a weak immune system.
Thank you for sharing that valuable information, Dr. Stanley.
It was nice to be here.
Bye! Now we're going to bring in a girl that has been infected with this disease so she can share her story and give us more information about MRSA. Please welcome Nikki Venkatraman. Hi Nikki, how are you?
Hi Katie, I'm doing pretty well.
That's great to hear. Do you think you could tell us how you got MRSA?
Well, one time I was at yoga. I had to borrow a mat for the class. I guess there was some discharge of the disease left behind on the mat because the next day my skin was bumpy and swollen right around an area where I had a cut on my leg.
That's terrible. What are some ways you can prevent from getting the infection?
Well, do not share personal hygiene items. And make sure all your cuts and wounds are clean and covered. Also, stay away from people who have the disease.
Thanks for that useful information. So what are some symptoms or some areas that the disease appears in the body?
The disease tends to go into cuts on the skin. Most people get small bumps that are red, swollen, warm to the touch, and have pussy drainage. Some people also get fevers and ulcers.
That sounds awful. How can you receive treatment for it?
Well, I sent a sample of my infected tissue to the doctor, and they identified what the bacteria was and prescribed me an antibiotic. Also, a physician may drain the cut or wound and use it to find out what the disease is and prescribe antibiotics to treat it with.
Thank you for such useful information, Nikki. Also, a big thank you to Dr. Stanley for giving us some great information to use as well. I hope everyone out there now knows how to prevent and treat MRSA. Thank you so much for watching Late Night with Katie Emer. Good night!
I can't! Okay. You know, disease tends to go into cuts on the skin.
Yoga for days! We'll stop it after the first one.
Yay! Yes! Take 3. Oh! Take 4!
Antibiotics in the penicillin.
Yeah.
Woo! Take 5. Go!
Hold on.
Take 6! Wait,
Slow
take
down.
7.
Take
Ready?
7. We got
Take 8. Go!
We're gonna call it good.